Exercise is proven to improve an individual's physical and mental health. Most of us understand that exercise improves cardiovascular fitness, muscle strength, agility, flexibility, body composition, mood, self-efficacy and body image, as well as reducing the risk of chronic disease, such as heart disease, diabetes and some cancers. For older adults, exercise is proven to improve balance and reduce that risk of falls. Exercise assists to improve one's quality of life, improve fatigue-related symptoms, whether that be disease and or treatment-related fatigue, decrease dyspnea or breathlessness, improve depression and anxiety, improve post-traumatic growth, for example personal growth, and improve sexual interest and libido in men and women. In a post-operative setting, exercise assists with better post-operative outcomes, including reducing the risk of chest infections, blood clots, and assists with a patient's functional recovery. The Australian Physical Activity and Sedentary Behaviour Guidelines for adults aged 18 to 64 recommends that adults should be active on most, preferably all days of every week, accumulate 150 to 300 minutes, which is 2.5 to 5 hours, of moderate intensity physical activity per week, 75 to 150 minutes, or an hour and a quarter to 2.5 hours of vigorous intensity physical activity, or an equivalent of combination of both, and also to be performing strengthening activities on at least 2 days of each week. The physical activity recommendations for older Australians, aged 65 and above, should aim to accumulate at least 30 minutes of moderate intensity activity on most, preferably all days of the week. Muscle strengthening activities on 2 or more days. People with poor mobility should do balance exercises to prevent falls on 3 or more days. And if older adults are unable to meet the physical activity guidelines, they should still aim to be as physically active as they can and aim to break up their sedentary time. So what is sedentary time? The Sedentary Behaviour Guidelines are aiming to minimise the amount of time spent in prolonged sitting and break up long periods of sitting as often as possible. Older people that have stopped or are beginning a new form of activity, start slow. Gradually build yourself back up to that ability to be achieving those guidelines. We do not expect you to be going from nothing to everything, so start slow and just do something. Something is better than nothing. Some older people continue to live a lifetime of vigorous activity, so keep going. If you love your kayaking or you love your hiking, keep going as long as it is safe to do so and you're enjoying it. So if you're worried a little bit about the financial side of exercise, remember that walking is free. However, if you do want some assistance from a physiotherapist or an exercise physiologist, you can go to your GP and get an EPC for chronic disease, and that will help cover some of the cost.